Um,
Good morning, everyone. Sorry for my delay. Good to see everyone.
Morning.
Um, since I did keep you waiting, why don't we jump right in? So welcome to the November meeting of the Katie Beckett Waiver Program Working Group. Would love to give my co-chair, well, I would just say I'm glad we're back together again and looking forward to today's conversation. And then let me turn it over to my good co-chair, Senator Lesser.
Thank you, Madam Chair. I don't have extensive remarks, just happy to get back to the work.
Wonderful, thank you. And I think it would be helpful, since we have a guest today, if we could just go around the room, the virtual room, so that they know who is in attendance. So if you don't mind, when I call on you, just please say your role at this table. Jennifer Hand.
Hi, I'm Jennifer Hand. My son Charlie, age 7, has Duchenne muscular dystrophy, and I'm founder of Charlie's Cure, and we have been on the Katie Beckett waiting list for about 4 years.
Great. Thank you. Sarah.
Hi, I'm Sarah McWickey. I am Representative Gilchrist intern.
Great, thank you. Jermaine Lee.
Hi, I'm Emily Germain Lee. I'm a professor and physician scientist at UConn, and my clinical work is all at Connecticut Children's, and I focus on rare disease, and I'm on the Rare Disease Advisory Council.
Thank you. Leslie Bennett.
Hi, I'm Leslie Bennett. I'm the co-chair of the Rare Disease Advisory Council, and I was the parent of a child who was on a DDS waiver for almost 30 years.
Great, thank you. Molly.
Hi, I'm Molly Cole. My daughter actually was the first child in Connecticut who went on a Katie Beckett waiver, and currently I direct the State Council on Independent Living.
Great, thank you. Louisa.
Hi, I'm Louisa Kelsner. I'm a child neurologist and a geneticist at Connecticut Children. So take care of many kids with rare disease, and many kids on the waiver program or a waiting list.
Thank you. Paul.
Hi, I'm Paul Chase from the Department of Social Services Community Options Unit. We oversee the Katie Beckett waiver. I've been attending these meetings, but I think I'm here officially in place of my director, Christine Weston, who's unavailable to make it today.
Wonderful. Thank you. Mary.
Good morning. I'm Mary Fitzpatrick. I work for the Office of Legislative Research. We're the Connecticut State Legislature's Nonpartisan Research Office.
Great. Thank you. Thank you for being here. Chandra.
Hi, I'm Chandra. I am the administrator of the working group and also clerk of the Human Services Committee.
Beth.
Hi, I'm Beth Friesa. I am the mother of a child who has a rare genetic condition. My daughter 9 has been on the Katie Beckett waiver for 3 years.
Thank you. David.
Hi, good morning. Dave Seifel, Legislative Affairs at DSS.
Thank you. Mick M.
Sorry, Dominic Cotton, rare disease advocate, and also have a son with a rare disease.
Great. Thanks for being here. Dana.
Hi, everyone. Dana Nestor with Senate Democrats. It's great to be here.
Great. Thanks. And Jared.
Hi, I'm Jared. I'm another one of Representative Gilchrist's interns.
Thank you for being here. And we are on CTN today. Before we get to, thank you everyone so much. Before we get to our presentation, can I have a motion to approve the meeting minutes from both September 30th and October 21st?
So moved.
All right. Moved by Leslie, seconded by Emily. All those in favor, please signify by saying aye.
Aye.
Any nays? Any abstentions? All right, the minutes are approved. So with that, I would love to move to our presentation today from the Office of Legislative Research. Mary, I'll turn it over to you.
Thank you. Let me just share my screen. Are you able to see the slides?
Not yet.
Interesting.
Now we can.
Great. Okay, as I said, my name is Mary Fitzpatrick. I work for the Office of Legislative Research, which is the nonpartisan research office for the Connecticut General Assembly. And today I'm talking through some research we did on Katie Beckett programs in 3 states, Minnesota, Rhode Island, and Wisconsin. So we were looking at program enrollment, which services were provided under the program, and program cost. Before we start, I just want to note that all 3 of these states are TEFRA states, which I know this group is familiar with, but that means that their services are offered as an entitlement under the Medicaid state plan, and there's no wait lists. So we'll start with Minnesota. So Minnesota's Katie Beckett program served 2,240 people in FY24 at a cost of about $26,000 per child. That's annually, or $58.5 million total annually, and that includes state and federal funds. The benefits are the same as the state plan benefits. So this program is chiefly providing Katie Beckett children with access to normal Medicaid services. For the Katie Beckett enrollees, these services are provided on a fee-for-service basis. So Minnesota also has separately home and community-based waivers that also serve children with disabilities. So these are the same 1915C waivers that can have wait lists or offer services that aren't broadly offered under Medicaid. So as a result, there are some children who are eligible for both Katie Beckett under the Medicaid state plan or services under the waiver, but in Minnesota, they have to pick one. And what that means is, even though there's no wait list for a Katie Beckett in Minnesota, the enrolled population might not represent the entire eligible population because some of those families have opted to be served under the waivers instead of Katie Beckett. That makes sense. So both Katie Beckett and the waivers had a cost sharing requirement up until recently. So the parents or families were expected to pay parental fees. These were on a sliding scale based on the family's adjusted gross income, but the legislature got rid of this requirement in 2023. Before we leave Minnesota, I'll just mention that in 2020, the state had a Katie Beckett working group that I linked to in the OLR report that goes along with this presentation. That group looked at eligibility and enrollment processes and how communication with the families was working. So that study may be of interest to this group. Okay, that's it for Minnesota. Next is Rhode Island. Because all of these states are TEFRA states, sometimes we need a little context about their Medicaid program generally before we dive into the Katie Beckett stuff. So Rhode Island operates its entire Medicaid program under an 1115 waiver. This is a demonstration waiver where the state asks the federal agency that oversees Medicaid, which is CMS, for permission to waive certain requirements so that it can demonstrate some improvement in some aspect of its Medicaid program. So Rhode Island's done this since 2009. They're currently in the 6th year of what was supposed to be a 5-year waiver. So it just signals to us that there are some things about this Medicaid program that might be unique and that they've had to get permission from CMS to do. Also in Rhode Island, they use a managed care program to serve children and families who are in regular Medicaid. This is called Right Care. That's capital R, capital I, like Rhode Island. And it's administered by 3 MCOs, managed care organizations, that are under contract with the state. So with all that context, Rhode Island's Katie Beckett program has 760 people enrolled as of last month, and the enrollees are split into 2 groups. So the first group has 81 enrollees, and these are children who have no alternative coverage. So basically, their families do not have commercial insurance that covers the children in any kind of way. So Rhode Island enrolls these children in Right Care. And for this group, the state pays $4,442 per child per month as a premium payment to the MCOs for that coverage. The second group is the remaining 679 enrollees. These are children who do have access to some other coverage. They receive services on a fee-for-service basis, and the cost per child will vary based on the family's needs. So children will typically get their primary care through their parents' insurance, and for this group, the Katie Beckett program picks up wraparound services that aren't covered by their commercial insurance. In FY24, the average cost to serve a child in this group was $1,820 per month. So to back up and be really clear on that point, because we were asked for costs for the different states, when we report the costs on a fee-for-service care, it's often retrospective because the costs are going to be changing all the time depending on the needs of the children enrolled in the program and the services that they're using. So the state is essentially making a payment for each covered service the child uses. When we reported on the cost to serve that first group through managed care, that cost was prospective. So this is the cost the state pays to the MCO as one payment for the child's care, and that's determined, through the contract or negotiation that the state has with the MCO, and that's regardless of what services the enrollees use. So I'm just flagging that as a reason why we can't put the costs neatly next to each other on a table because it's not really apples to apples. So in addition to the fee-for-service group, the state also pays $126 per member per month for case management services, and that amount is constant. Case management was a factor in a settlement agreement in 2022 between the state and the Katie Beckett family, who claimed that the state was unable to provide services their son was authorized to receive. So among other things, the settlement agreement required the state to review its Katie Beckett policies and ensure that, that enrollees who are eligible for certain services receive them in the most integrated setting appropriate to their needs. So that kind of language that's ADA, that's Federal Americans with Disabilities Act language rather than federal Medicaid law. It looks like the settlement agreement has expired, but they may have retained some of the changes that they made there. So we noted it here for reference. So for services, like the other states, Katie Beckett enrollees in Rhode Island receive the same services as those authorized under the Medicaid state plan. But the state plan includes certain services that are specifically for children with special healthcare needs. So this is a larger group than just Katie Beckett, but it includes Katie Beckett. And the services available to this group include home-based therapeutic services, personal assistance services and supports, and respite. Okay, that's it for Rhode Island. Our last state, Wisconsin, has a much larger Katie Beckett program with 13,500 enrolled as of last month. The state provides state plan services to this group on a fee-for-service basis. Unfortunately, we were unable to get cost information. But like Minnesota, Wisconsin also has 1915C, these home and community-based waivers that Katie Beckett children are also eligible for. But unlike Minnesota, children can be enrolled in both programs. So they're essentially layering coverage. So Katie Beckett gets you Medicaid state plan services, and then children can additionally enroll in what Wisconsin calls the Children's Long-Term Support Waiver, which provides things like home and vehicle modifications, for example. Then there's a third program that's not Medicaid. So it's not a waiver, it's not the state plan. It appears to be solely state funded, and that's the Children's Community Options Program, which provides some additional services, but can vary based on funding. So the next slide might be a little difficult to read, but it's from the state's website in Wisconsin, and it shows services available under all three programs. So the left column is Medicaid or Katie Beckett. The middle column is the waiver, but in some cases, the solely state funded program might cover these services too. And then the last column is just the solely state funded program. And in some cases, which program picks up which services will depend on which program or programs the family is enrolled in. So that's all I have for you today. If you don't already have it, the report that goes along with this presentation is Katie Beckett Programs in Select States, and it's available on the OLR website. And I'm happy to take any questions anyone has.
Great. Thank you so much, Mary. I do see Emily has her hand raised, and other folks feel free to raise the virtual hand.
Yeah, I apologize if this shows my ignorance, but I looked up the population of Minnesota and Wisconsin, which are very similar. But Wisconsin's helping 6 times as many kids. And is this purely financially based on what the state has or how they decide to allocate it, a combination? It seems so discrepant. You'd hope it would be equivalent no matter what state you're in.
Yeah, I think part of that is because the number I showed for Minnesota, the enrollment is just in the Katie Beckett program. And some of those families might be opting to receive service under a waiver, so they wouldn't be included in that count. So in that way, whereas in Wisconsin, they can be enrolled in multiple programs, so that enrollment, so they don't have to choose to forgo Katie Beckett and just get services under the waiver, so they can do both. So that might lead to a higher number in Wisconsin.
But what would the rationale be for that they don't let them be in other? I'm just trying to understand how it's thought out.
That's a good question. It could be fiscal, or it could be just the history of the way the states have designed their programs.
Thank you. Anyone else? Questions on information that was presented? All right, well, thank you so much, Mary, and we'll be sure. Chandra, did we send out the report? I would assume so, but if not, we'll get it out to folks.
Thank you.
Thank you.
I'm going to send it out again, just in case if I didn't. Apologies if I did not.
No, awesome. Thank you. Okay, so moving to the next piece, we wanted to pull up the Public Act. Do we have that easily accessible?
Just give me a second. I'll pull it up.
Thank you. I appreciate it. And the charges of the working group, because we want to check in now that it is mid-November. We've had a handful of presentations and conversation. Just want to make sure we revisit what we were charged with and want some support and feedback on where we go next from folks. Should say just quickly, and Paul is on, Department of Social Services, I believe by next meeting, will be able to give us information on both the breakout per person cost, and then now I'm forgetting what else I asked. I asked for, okay, yeah, thank you. And then I asked for information
We
about
have the reliable query for the cost, but we want to get, anything we report out, our fiscal likes to look at first to make sure we're actually reporting correct information. So that's happening now. So we'll definitely be prepared by next meeting.
Okay, fantastic. And then another outstanding request, just so everyone's on the same page, asked for information on both the client-facing side on what it looks like to apply to be on the program, and then the administrative side of maintaining the program so that we can better understand what that looks like. Okay. Thank you, Chandra. And so really, I'm hoping for a conversation with you all just to understand where you think we should go next. Because I'll be honest, I'm at a place where I've pitched a few presentations. I feel like we've gotten some information. I've learned quite a bit already, but really need some support from you all on where we go next. And I guess when I say that, be thinking like, is there additional information we need to obtain? Are there conversations we need to have?
I would like to say from a perspective of the DSS perspective of having at least initially seen the query we're running for per member, like per person cost, that might provide some context regarding number one, with the strategies to eliminate the wait list. I can't conceptualize exactly how, but I think it's going to put some things in perspective. But I don't want to, without having the information, I don't want to say too much.
Okay, thank you. Yes, Jennifer, go right ahead.
Just based on the conversations that I've heard so far in these meetings and the presentations, it seems like we're all sort of in agreement that anyone who is theoretically eligible for these services should get them as soon as possible. I don't think anyone disagrees with that. I think it is a fiscal issue. And so I think what you're saying, Paul, in terms of understanding the exact costs and monies that would be available to help expedite families that are on the waiting list would be critical to help us make a recommendation.
Okay. Great, thank you. Senator Musk,
Yes,
followed
thank
by
you. Sorry about that. Just a question based on Minnesota's experience. I know that they previously had a sliding scale fee program for families based on their ability to pay. And they also had, I think it was another state that had a separate program for folks who are uninsured versus folks who are using this as supplemental insurance. Just curious, obviously at some point this is just going to be a fiscal question, and we're just going to have to engage our friends on the Appropriations Committee and see what they are able and willing to do. As we are just being mindful of potential cost constraints, I don't know if any folks, both on the capacity side, could agencies potentially implement cost controls like that if we were to try to use those to make it more affordable to expand coverage? And two, do the advocates, parents have thoughts about whether or not those are good approaches, or would that sort of defeat what we're trying to do? So that's I guess those are the questions that I had sort of looking at that report.
Thank you. Taking notes. Okay. Molly, followed by Emily.
So just, in looking again at the charge to this group, some of this really almost reeks of rationing services, which I think is not the road we want to go down. It's very concerning to read it in that framework of tracking people by life expectancy or tracking people by type of disability is kind of a scary way to go. And I would just want us to be cautious in thinking about how we word this, because I will tell you that that's definitely not the route you want to go down in figuring out what to do with this waiting list. To my mind, the focus of the waiting list is how do we open it up? How do we get some recommendations for the cost related to that? But certainly not to say we're going to eliminate the waiting list by prioritizing some individuals over others. So that was just my caution.
Thank you. That's very helpful. Emily, followed by Jennifer.
I think I want to echo that thought. I agree, because I feel like it's no longer up, but I felt like number 1 and number 2 all tied into number 4, which was basically determining definition of what we're going to call terminal, what we're going to call a worse illness than another illness. I feel that's like a very dangerous, slippery slope when you're going that way. It's sort of like ranking by how bad it is. And there are a lot of things that can't be defined just by terminal illness or the disease. So I really do agree with Molly. It's an ethical dilemma, really. And that's going to be very difficult to prioritize based on those types of things.
Thank you. That's very helpful. Jennifer, followed by Paul.
This is just a follow-on to the last two speakers. And I think it's germane. In the past, in recent history, the life expectancy for Duchenne patients has increased by 10 years just based on quality care alone. And we now have a number of new FDA-approved therapies. So tracking kiddos, and this can't be the only disease that that's true for. So tracking kiddos by what life expectancy they had before may no longer apply to their life expectancy now. So it seems like a very sort of myopic way to go about it.
Thank you. Paul?
Maybe a quick question for Mary, and you might not have an answer to this. But I wrote down some notes and I saw with Rhode Island, the 81 individuals with no alternative coverage. Rhode Island, was that, or was that not one of the states that also allowed individuals to access services through a waiver? Or was that just straight for a straight state plan?
Let's check.
And I say that just leading to, is there any kind of prioritized coverage for individuals that already have, or that do not, I'm sorry, have alternative coverage? Or if it's just state plan, it wouldn't matter because it's an entitlement and they can access it.
Yeah, we didn't come across 1915C waivers that had overlapping eligibility with Katie Beckett for Rhode Island. And I'm sorry, your second question was like the prioritization.
Well, right. So you gave us the breakout, and I'm trying to think, was it just the 81 with no alternative coverage versus the 679
Yep.
That had access to other stuff? Is that just for a cost perspective that you broke that out?
Well, it's both cost and the way they're served, because the ones with no other coverage are going to go to the managed care program in Rhode Island, and the ones with other coverage are going to be served by fee for service.
Okay, thank you very much. I'm just thinking
You're
about
welcome.
it from a wait list perspective. If there's any way potentially that we prioritize those without, but I guess somebody with insurance doesn't always have to have insurance, so they could have it and then not have it. And
That's right.
That changes their scenario. So thank you.
Thank you. Beth, go right ahead.
Thank you. I think we should focus, I know we're talking about prioritizing and how that could be difficult to do, and we should be sensitive to that. But I think we should start looking at the waiting list and trying to figure out how to communicate with people on the waiting list. Maybe not making a priority list, but just start communicating with people on the waiting list and start focusing some of our efforts there, letting them know what's going on, what we're doing, trying to keep in touch with some of the people so that when I was on the waiting list for 4 years, I didn't hear anything for 4 years. But if we can't necessarily prioritize, we could at least start some outreach or start some education or start, at least letting people who are on the waiting list know that they're there and they're seen, and that we can focus some of our energy that way.
Great. That's very helpful. Thank you. Molly?
So I totally agree with Beth. I think if there's a way to really look at who's currently on the list, what it is they're looking for, how long they've been on, have their needs changed? Because we don't know. I mean, some of these people have been on the list for a long time. You don't know what their needs are. We don't even know if they went on the list seeking something that actually needed to be provided through a waiver. I mean, I can tell you, because I used to get calls all the time from families saying, I want to get on the list. And I would ask them what they wanted or what they needed. And what they were looking for really wasn't what that waiver was created for. And so, having a deeper conversation with them about other places they could go and other resources they could seek out was often a very fruitful one. So, it could be worth the effort to try and not just call them to see what their status is now, but if there are things they're looking for that maybe they can look for in other places, that could also be really helpful to them.
Great, thank you. Yes, Emily, go right ahead.
So I have a question for people who've actually experienced being on this. Are there updates given? Because diseases often change dramatically, status changes. There's so much that happens. 4 years, I just heard that's a long time. Like, I'm just wondering practically.
No updates. You're in a vacuum. You just have no idea where you are, when it's coming.
But like, do you have a chance to update? Like, things have really gotten tremendously worse now.
Oh, there's no outreach at all.
Is there a way for us to create like a website for you to just put in your information and just see I'm number 212 or 47 or something? Is that something that we could do if we wanted to?
Yeah, I mean, I think any of this is conceivable and practical as far as providing updates, and I wouldn't, I don't want to speak for my agency, but I necessarily, but I don't think it would be particularly, difficult to do. Just to give you an idea of like how we operate the waiver right now, and we'll be prepared to provide some more specific details next meeting on the actual logistics of the application process. But yeah, step one is getting on the wait list, right? And then there's a period of time, which is unfortunately long right now, where there isn't a lot of communication. We do have one assigned staff person, one clinician, a nurse that is the only individual that works with the waiver. So that's her sole job, is to work with the Katie Beckett waiver population. She does a tremendous amount of work with the current participants, and at the time of offering a spot. And one of her primary focuses, which relates to the wait list, is trying to get individuals who may be able to transition off the waiver and receive Medicaid otherwise to, have that process take place so it can open up a spot for somebody on the wait list. So that I know is what she spends a majority of her time doing. Doesn't take away from the fact that, having outreach during the waitlist process could be beneficial, and even beneficial for us if we go years without talking to somebody, even if something as simple as where do you live, what's your phone number, has anything changed, do you still want the program? Yes, absolutely. We can see how that would be beneficial. And it's something that I would think would be conceivable for us to be able to do at DSS.
Thank you. Beth?
So I think, and if I'm not mistaken, what we were charged as a committee is to see where funds can be best used. Maybe we do need more help on the Katie Beckett waiver side with looking at how we're going to process these applications and manage the wait list and manage all of this stuff. Because if there's only one person who's doing all of this, and there's a lot of people who are applying or waiting, like Molly said before, maybe there are other people who will be better served who are on the waiting list on a different waiver or in a different program. And just by nature of having another set of eyes looking and going through the list, or managing that list, by nature, someone is going to get off the Katie Beckett waiver, and someone who needs to be on the Katie Beckett waiver would take that list, and that person would then be better served on a different waiver. So I don't know if we, are talking about using money and where it should be sent or used, but if there's only one person who's on the Katie Beckett list reviewing all of these applications and managing all of the people on the wait list and trying to figure this all out, that might be something. I don't know if we have the power to look into that or not, but it seems like that might be a good idea as well. Again, I'm just a mom. I was just on a wait list for 4 years. I, don't understand the complexity. I know it's very complex, but I'm just trying to shoot out ideas that would be helpful for, maybe something that could reduce the wait time and maybe make an impact on some of the other families who are not yet getting the services.
Wonderful. Thank you, Beth. And I would say you are a mom, and that is enough. So thank you. And your opinions are really important. So I appreciate it. So I've been taking some notes, and please let me know if I'm off on any of this or if I'm on the right track. But it seems like what would be helpful for our next kind of like where we're going is folks are on, it seems, the same page that services as they are good. We just need more people to have access to them quicker. And so how do we open it up? So that's this funding question. We don't like any of the ranking and like diving deep into how we kind of put one illness against another. So we avoid that conversation. And then really looking at this management piece of the Katie Beckett waiver in terms of how are people like first brought onto the list? How are maybe they'd be triaged into a different program, the communication, keeping up with folks. And so kind of going down that path and having that conversation of what that could look like. Am I missing anything?
One thing is just a website. You know, I know you can't use datification for things, you know, everything. And there's so many nuances, which is why you need a person in your office to be doing this. But there must be some way just to, you know, have people be able to check. A website would be one really great way where you can just check and see numbers, give families something quantitative, or, you know, a lot of planning goes into having a child who's suffering so much. And, you know, going 4 years, this is just an example I heard, you know, how do you even plan your life? Maybe if you could see numbers and like how things are changing in rank or what's going on, just some information to be able to plan your life a bit, as much as can be planned when you're, which, you know, can't really be planned when you're caring for a child with so many needs, but at least it gives you a little bit of empowerment.
Agreed. Okay. Right now, I know people have probably said this before, there's no website at all, or is there a piece on the DSS website that just talks about the program itself, but there's
Just a general overview about our waiver programs, but nothing specific to the wait list or anything for any of our waiver programs, not just Katie Beckett.
Okay, thank you. Sorry, Leslie, you were going to jump in and then
Oh, no,
Jennifer.
I was just going to say, it would be nice if we had some sort of way to tell parents what waivers are out there they could qualify for. And I mean, there's DDS waivers that some of these children who are critically ill should be able to get a DDS waiver. A lot of them have neurologic impairments, and it's difficult to get into that. I know when my daughter Kelly was born, she was placed on a DDS waiver. She was identified very early by one of the leading neurologists in the state. But DDS at that time had a nurse and a social worker come to do an evaluation. Now, they would come every 6 months, but that really helped us. Those programs no longer exist. But that really helped us, and they were able to determine right away that Kelly needed help. The letter that you received from in the past that you read about the woman talking about how her child had seizures and didn't sleep, that was my life for the first few years. And DDS could come, and as Kelly's condition progressed, they could give me more services. So that really helped. But I'm wondering if we can offshoot some of these children on the waiting list for Katie Beckett to the DDS program. I don't know what the waiting list is like there, but I believe it's shorter. So if we could have some sort of central way where parents could look, and physicians especially could look, and see the waivers that are available, and get an idea of what a child might qualify, that might help too. Might also lower the waiting list for the Katie Beckett waiver program.
Great suggestion. Thank you. Okay, wonderful. Jennifer, followed by Louisa.
Yeah, I think my comment or question kind of echoes what Leslie just said, and some of the observations I made during the presentation about what's available in other states. There's really no global view of what, you know, my son might be eligible for. And, you know, right now his needs are primarily, you know, psychosocial and behavioral. And then we're anticipating, you know, as I brought up before, we're anticipating accessibility needs in our home and vehicle. And those are definitely available in other states, not under Katie Beckett, but under other options that families have. And I just have no idea in Connecticut. I was just sort of told at diagnosis, oh, you want to get on the wait list for Katie Beckett? And I was like, all right, sure. I didn't really know what our needs would be. I don't know if there's other things that I should be looking at right now. Is it naive to think that there are other things like, you know, in Minnesota, there were a couple different options that families could choose. In Rhode Island, I think there were 3. Are there other things I may not know about? So I think having that global view of what, your needs may be as a family and what Connecticut can offer you is something that would be incredibly helpful.
Wonderful. That's really helpful. Thank you. Louisa?
Yeah. So I guess I just wanted to throw in, I know we're talking a lot about reducing the waiting list, which is obviously important, but I suspect there's many, many more children in the state that are eligible and would benefit from the program who just don't know anything about it. There's, I think just increasing awareness broadly is essential. And there could be 5 times, I don't even know, there could be so many more children, I think, that could benefit, because there's tons of kids with terrible epilepsy, cerebral palsy, all kinds of genetic conditions. So I suspect there's so many more kids than we're seeing on this wait list that could benefit from services.
Okay, thank you. That's very helpful too. Okay. All right, this is very helpful for me for our planning for some next conversations. So I really appreciate it. Can do some digging to get some examples, some further conversation with DSS. Anything else anyone wants to share about our charge? Yes, Dave, go right ahead.
Hey, thanks, Rep. Gilchrist. I just had a quick question, looking for clarity on something Emily mentioned a few minutes ago, about maybe building out our website and getting a list of the wait list order. Is that what you were envisioning, Emily? Like just going online and seeing where your son or daughter may rank on the wait list out of 400, they're number 35, or is there more that you were thinking?
Well, I don't know what's allowed to be put on there and not. I don't have enough, the knowledge probably that Mary or Paul have in that. And how definitive it is when you're ranking, and it may vary month by month, but it certainly would be nice if it could in some way be datafied so that that rank could be seen and transparent, that parents aren't in the dark. And there'd be no names, but they'd get a sense of where they stand. I don't know if that would help. I'm just, just in hearing sort of this black box, I just thought it might be an easy, no cost thing other than developing a program that can do it. It's just a matter of feeding in numbers, really.
Yeah. Beth?
I guess I'm envisioning, kind of along that line, like when you sign up for, Social Security, or even if you sign into, your Old Navy account where you can sign in and check your order status, or an Amazon status. If there's an account, you can sign in to see what your status is, or your position is on the Katie Beckett waiver list. I think that's something that maybe that would be helpful for. I know like Social Security has my SSA.gov where you can go in and see where your application is pending, and you sign in, use your credentials, and you sign out. Again, that's a bigger agency, as a federal agency. I don't know what kind of logistics would have to go in, but something like that might be helpful to somebody who's applying for the Katie Beckett waiver, so they can go in and check in at their own time to see, where their application is in the process. And I also think the other thing I was kind of envisioning was a bigger website just for the waiver itself, the Katie Beckett waiver, what to expect when you apply, what services you can get while you're on the Katie Beckett waiver, and all that other kind of stuff. So I think I just wanted to make it clear that I was kind of envisioning that we would have 2 different, web ideas, an overall website. I know we do have that one page, but both my husband and I have master's degrees, and it took us forever to find that one website, that one web page. And I'd like to make it more transparent for people who are actively looking for it. So that was all. Thank you very much.
No, thank you. And also, like you were saying, to have like the full breadth of what potential waivers folks could be eligible for. Yeah, as like a first step. And then if it is determined Katie Beckett's the way to go, then how do you, yeah, have like an account where you can check in? Okay. Molly? Oh, you're muted.
Just an add-on to that, that maybe you also want some links to where else you can go for support or assistance while you're on the waiting list. Other parent groups, other organizations that might help you, and some potential other ways to explore how to get support during that time, just so you're not kind of out in the cold. Obviously, what we'd really love is to see that, the waiver expanded and an adequate amount of funding to be able to serve everybody. But if that's not going to happen, let's at least try and think of some ways to be better at supporting these families.
Yeah. That's really helpful. Thank you. Yeah, Emily.
Yeah, I just wanted to say, I also think it would be good for physicians and other healthcare practitioners. I honestly don't know everything out there, and I'm always learning more and more. And just where everything could be loaded on, even to refer other physicians to, I just think it's just not, it doesn't get the full attention it truly deserves within the medical community from the provider side. So it'll be helpful in that regard too.
Thank you. That is, yep. Okay. This is very helpful. All right. Any other thoughts or feedback?
Yeah, I had a few thoughts that I'm going to add on to this. I think what you're discussing about managing the wait list would probably be well applied to all the waiver programs, because I know I've had specific experience, obviously working with the brain injury waiver for the past, I don't know, 25 years, and issues we had some 10 years ago when we changed around, I guess, and had reserve capacity for certain populations. I know we had some issues with DSS back then where there was a long wait list and we kind of felt like people were jumping the wait list, which I know I think so, I hear some of your guys' concerns about that. And they added in slots at the end in order to get it passed. But I think there's a lot of people out there who don't know where they stand as far as the waiver programs and what's available to them. And I think obviously managing that better is something that would work for all populations. The other thing that I took a look at, or in the discussions that have been ongoing, it seems like you have three kind of categories of people that are looking for services on the Katie Beckett waiver. Some are looking for the backup of having the Medicaid program as far as insurance wise. Some people actually need home and community-based services, and some people need like some of the other services that might be available. I know the big one that kind of came up and brought around this working group was around, I think, the people that needed more home and community-based services, and being able to help them find that. I think those are the people that are kind of like at the highest level of a need. And I know we have programs like Money Follows the Person. I don't know if that would work or if that is available for young children who might be at a hospital level of care. That obviously it would be less expensive to have them in the community than it is to have them continue to remain in the hospital level of care. I know for my experience working with brain injury, I mean, there's a great reduction of, I don't know, hospitals usually run about $400,000 to $600,000 a year versus somebody in the community 24 hours a day is sometimes half that or a third of that, depending upon what their needs are. I know on our programs, originally when they changed over the waivers, they put in reserve capacity, which if you are going to increase the Katie Beckett waiver, and people who desperately need that level of service. Maybe putting in like a reserve capacity for that group of people while expanding the overall numbers doesn't kind of pit one group against the other, so to speak. But those are just some of my preliminary thoughts. Thank you.
Great, thank you. Thank you very much. Okay, I think we have a good amount of food for thought to lead us into our next meeting. And so between then and now, Dave and Paul, I'm going to be reaching out to have some conversations. Because it'd be great to kind of get some insight onto what it would potentially look like to build out a website and that sort of thing. Okay, so if there's nothing else for today, then I will adjourn us for today and we will come back. Our next meeting is scheduled for December 2nd, 1 to 2:30. At that point, we should have some financial information. And then I will gather follow-ups to today's conversation. Wonderful. Thank you all. This was very, very helpful to get your thoughts and feedback. Kind of for me, it feels like a midway point. And so it's nice to kind of regroup what we've heard, where we want to go with the time we have left together. So thank you.
Thank you.
Since I won't see you, have a wonderful Thanksgiving.